Lovely. So we are here today with Time to Talk, and I am joined with by Dr. Susana Moreira, who I'll let do a little bit of an introduction. So Susana's been with us
For a few months.
few months now, a lifestyle medicine doctor and GP like myself, and I guess we kind of thought we would do this topic today because you ran a kind of a group last week for a number of patients, and actually the topic of fatigue seems to be something that really resonated with a lot of people. Even the staff here wanted to come because it's something that we were all kind of familiar with, that feeling of being tired a lot of the time, and just, I guess, wanting to get our heads around whether that's something we should be worrying about and what we can do proactively to help that. I mean, do you want to say anything about why you chose it as a topic?
Yeah, absolutely. So, as you said, I've been working as a GP for many years, both in the NHS and private sector. And I think we see this topic very, very often. I mean, I would actually say with a lot of confidence, I almost see a patient concerned about energy levels and fatigue every day. And absolutely, I know people do come to see us because they're worried about potential medical reasons that cause it. And in loads of situations, we do need to rule those out. I mean, we can't just ignore things like chronic fatigue syndrome or fibromyalgia or even thyroid problems that can cause this. But it gets really frustrating when patients come to see us to check all of that. And the majority of times you do run bloods. And when they come normal, it's down to, okay, so everything's fine. This is really frustrating. What do I do now? Why do I still feel so tired? And I did think about this topic because it's very, very common. And also because we can't just reduce it to one particular thing. I know in loads of patients, there are nutritional deficiencies, which we see a lot more these days with the way we live our lives in our society. I mean, we do see a lot of iron deficiencies, vitamin D, and that can cause people to feel tired. But at the end of the day, it's usually not just one thing. It tends to be a multifactorial thing, and a big chunk of it comes down to lifestyle factors. And that's why I thought it would be an absolute perfect topic to bring in. Like you said, loads of people seemed, oh yes, I feel like that all the time. So yes, I do want to know more about it.
And actually, I think the feedback that I get from patients quite a lot, and I'm sure you've had it yourself, is that they've maybe had this in another setting where they've been worried about the fatigue, they've had the blood test done, they've been normal, and they've been given that message, well, there's nothing wrong and there's nothing we can do for you. So the lifestyle medicine bit, I think, is really lovely because actually there is quite a lot that we can do. And I think we thought it would be really useful as part of this to kind of just work our way through the kind of different pillars there and what that means.
Yeah, absolutely.
So do you want to kick off with sleep?
Yeah.
The one that you kind of said.
I mean, before you actually touched in a very important subject there, because we can either go to the point where, there's nothing else we can do and everything's fine. So you just need to live with it and learn how to feel tired all the time. But we also need to be very careful not to go down the route of blaming, oh, you're tired because you are doing this wrong. Absolutely. And I mean, it's not about blame, it's actually about learning what things we could be doing better. And sometimes it's a little bit of our control. I mean, society is different, our lives are very stressful, but sometimes knowing simple tips and things that we can maybe incorporate in our day-to-day life is really easy. Absolutely. But as you said, starting with sleep, and I think this is the first thing people think about, isn't it? It's tired because maybe I'm not sleeping properly, or actually they come and say, but I do sleep a lot, I don't know why I'm so tired, I shouldn't be feeling this tired. And it's more than that. And sometimes the timing of the day where you feel tired gives you a little bit of an idea whether it's to do with sleep or not. If patients come and say, I feel tired as soon as I wake up, then maybe sleep is something to explore, isn't it? And I tend to say, and studies have shown, that it's not so much about the quantity of sleep and the amount of hours we're sleeping. It's actually the consistency and the quality.
Yeah.
It's actually that thing of trying to wake up every day at the same time, and trying to avoid things that interfere with our sleep in the evenings, like drinking caffeinated drinks really late, or the screens, which are all very addicted to in the evenings, and getting that morning light in the morning, which is so important, isn't it?
Yeah. And I think there's another few kind of things that I've been kind of talking with patients about, is just that activity that we have during the day can make a massive difference to it as well.
Yeah.
And actually the other kind of pillars generally in terms of the nutrition and the connection and all of those other things actually relate across as well, don't they?
Yeah.
I think you're right that sleep is one of those areas that, again, I think it comes with less blame attached to it, because I think there is an appreciation that a lot of people struggle with their sleep, and it's not something that necessarily is to do with what we're doing. It's something that we struggle with. So I think, as you say, it's about maybe making the odd little change, and that regularity of sleep seems to be massive in terms of waking up and going to bed at the same time every night, as being probably a good starting point for helping with that. Nutrition, what are our big things?
Yeah, well,
fatigue when it comes to nutrition.
We could be talking here for hours
Yeah.
about this, isn't it? But yeah, I think from what I was reading and all the studies I was checking in terms of fatigue, it all comes down to the variations in terms of sugar levels. Our bodies tend to cope better when there is more stability in how our sugar peaks are happening. We know, and evidence shows, that if we're having loads of processed food or high sugary foods, our sugar levels will spike very quickly after the meal, but then they will crush very quickly after as well. And these kind of very sudden spikes and crashes can make our energy levels really low and us feeling really tired. And we see this in in patients who say, oh, I feel okay when I wake up, but then after the lunch I just crash. So it's the midday dip in energy levels that kind of points out, well, it could be to do with what you're eating and how your body is processing it, isn't it?
Absolutely. And there's a kind of a two prong thing to that, isn't there? It's what we're eating, but also timing of when we're eating.
Yeah.
So again, I think there's something about not eating heavy meals towards the end of the day in terms of what our gut microbiome is trying to do, because we need the gut to be working well for us to be able to be kind of sleeping. It's back to that good quality piece, isn't it, in the evening? So there's something there about hitting kind of good protein intake through the day to steady our sugar levels. There's something about not eating too late at night.
Yeah.
And again, I think you were saying about the processed and sugar content of what,
and avoiding them, and kind of starting the day right as well, isn't it? Kind of that you mentioned about the protein, the importance of having protein at breakfast, instead of just a only carb breakfast or carb-based breakfast, isn't it? So having that extra energy to boost the day, and it will kind of change how we feel, isn't it?
Yeah. And I think nutrition, again, just a last maybe point on that, is that the thing that comes up a lot about nutrition is planning. So I think often a lot of us know what we kind of would like to be eating, but because we're rushing and we're busy with our lifestyles, we tend to make very quick decisions, or we grab things quite quickly. And if we can take the moment wherever it exists in our week, be it at the weekends or at the beginning of the week when we're doing our weekly shop, and actually put some planning, it tends to help a little bit. But I think, going back to what you said before we even started this, it's not about getting things perfect. It's about kind of looking at whether there's any little easy tweaks that we could be making that might make a difference.
Yeah, absolutely. Yeah, and it's the planning thing, because things are so much easier when they become a routine, isn't it? So, and if we've been doing something for ages, it's just quicker and easier, and we get used to it. So sometimes it's choosing the right changes, isn't it? So the ones that are or seem easier and doable, and start with those. And if it's down to, okay, so let's see if I can maybe change what I'm having for breakfast, and once it's in your routine, it just carries on, isn't it? It's just the change that is kind of needs the most energy to begin with.
Absolutely, it almost becomes automatic, doesn't
Yeah.
it? Where have we gone? We got movement next on our list.
Yeah, and this is an interesting one, because when you discuss with someone who's been feeling tired and no energy, and you say, well, you need to move more, you need to be more active, you're going to think, I'm so tired, I have no energy to do anything, let alone do any type of physical activity. But we do now know that energy creates energy, and the more active we are, the more energy we have, and the more energy we want to spend. So even if it's just a very little movement throughout the day, or little walks after our meals, even if it's 5 or 10 minutes, it can make a big difference. We know that it's not, there used to be kind of an idea that if you're moving, you're not sedentary. But we know that things are not separate. You can be quite active, but still be quite sedentary. If you're spending loads of hours sitting at your job in front of a computer, that can have a massive impact, even if you're then going to the gym 3 times a week. So it's just breaking. If you have, for example, a very sedentary job and you're in front of the computer, try and make 5-10 minutes breaks to stand up, go for a walk, come back. This can make a very big difference. And it's not actually doing proper exercise, going to the gym. Like, I know some people will just say, no, it's not for me, isn't it? Yeah. So
absolutely that. And I think that's probably the kind voice that comes with this, isn't it? It's not an expectation of us to be going off and doing an hour at the gym or running for like a marathon. It's the little moments that we have through the day that actually make a massive difference. And there probably is a kind of I think you've mentioned a couple of scenarios of things like chronic fatigue, chronic pain, where I struggle a little bit with this pillar, because there are some people that actually movement can be difficult for. So there's something there about maybe involving someone else in this process with you, so that you are moving at a level that your body appreciates and finds nurturing, as opposed to any movement that is going to be painful or going to be causing more problems. So there is probably some value in, if this is tricky for you, having seeing someone like ourselves and having a proper conversation.
And some advice.
Doing too much too soon, going gently, all of those things, so that we're not kind of giving ourselves injuries. But generally speaking, a lot of this conversation is general, isn't it? Individual, like doing some movement tends to be. And
there's no specific goal. I mean, when we talk, I mean, there's loads of conversation around the certain amount of steps you should be having every day. And I think this is not the same for everyone. If you have someone who doesn't do any activity at all, doesn't walk pretty much all day at home, then anything above what they're already doing will make a massive difference. And those are actually the ones who benefited the most.
I love that.
So there's no specific goal, and there's no right or wrong. If you're doing, and in those particular situations with patients with medical conditions that prevent them from being more active than sometimes what they would like to, it's just whatever you feel your body allows, even if it's just a tiny bit more than the previous day. Great, wonderful. Just stick with it.
And probably as well, that kind of rest and recovery piece is really important for that as well. Next thing on our list is the kind of stress management, mental well-being, that kind of space as a pillar.
And that's the trickier one, isn't it? Because it's easier said than done. We're all living in very stressful lives in our own ways, and it can be really difficult. But we know that cortisol, I mean, people call it the stress hormone, isn't it? We do have a normal variation throughout the day that our bodies are aligned to. And if this goes off, it can affect the way our energy levels are. We know that the cortisol levels should drop in the evening, so we can rest better, we can fall asleep better, and then they should spike in the morning again. If we're stressed all the time, cortisol levels will be high all the time, so they don't go down, and our body needs that to rest and recover, isn't it? So and there are loads of different things that people can do to cope with stress. Obviously, ideally it would be remove the stress, but that's not possible. But loads of things like breathing techniques and mindfulness. Obviously, Lucy, who works with us, she does loads of work with that, and that can make a big difference.
And it is tricky, as you said, because it's different for different people as to how people will manage their stress. So I've got some patients who that kind of space of being creative can be really helpful. others that will find journaling really helpful. Some people, like for myself, it's more about being actually physically active is actually how I manage my stress. It's, again, there's something here about understanding what helps you as an individual. And I often work with people as well around that and giving them permission to do this, because I think often people don't, there's this kind of thought that self-care in some way is selfish. That's that cliche. When we actually know that it's really not, and it's something that is as fundamental. It's why it's part of these pillars. It's as important as our nutrition and our sleep and our activity is managing that stress, because it is detrimental to our physical and mental health.
But yeah, mental health is still a little bit of a taboo, isn't it, when compared to physical health? Seems like it's, but yeah, absolutely. And we are obviously talking about these pillars separately, but they're all interconnected, isn't it? Because if our mood is better, if our mental health is better, we'll sleep better, we'll have more intention to do physical activity. So all of it is connected. We can't just separate them, isn't it?
Next one, connection.
Yeah, and that's one that sometimes people just ignore, but it's very, very important. I mean, the way we connect with people, and these days with our society, we don't connect with people so much as we used to. I mean, we were just discussing about this one way, that with how technology has made our life so much easier, we can now do everything behind our computers. We don't actually need to interact, and connection for human beings is so important, and being surrounded by people or things that makes us happy, and this can have a absolutely important role in our energy as well, and how depleted we feel, isn't it?
And we were talking as we come on, because I think as a practice we kind of know that there are some patients that we work with who really struggle with that social connection piece, but actually that sense of connection and a sense of belonging can also come from some people from having their pets, or being out in nature, or being more connected with themselves. And it's the one that I kind of link across to just being more present in our lives, and however that looks for you, which might again be different from one person to the next, but it is just understanding what that does in terms of our energy. And actually maybe that's the thing that we could be working on,
just doing the things you enjoy, isn't it? They give you the energy
each day, for sure.
Yeah, absolutely.
And then last pillar is sort of negative behaviors. BSLM has it very much in that addiction space, but we often talk about other things that we do that are detrimental to our health. We've all got them.
Yeah, absolutely.
Any kind of top tips that come from that pillar?
I mean, this is probably the one that people do know more about it, isn't it? Because we're always talking about how bad certain things are for you. I mean, certainly everyone knows about the risks of smoking and alcohol, caffeine. But I think, especially when it comes to things like caffeine, it's more to do with the timing as well, isn't it? Especially if we're talking about tiredness and then the impact on our sleep, trying to avoid those things in the afternoon or late afternoon going into the evening. Even some studies have shown that actually the timing of you having your first caffeinated drink, it should be the late for 16 or 20, 90 minutes after you wake up, and not just the first thing you do. And I know most of us will just reach for the coffee first thing in the morning, and that can have an impact. But also not just this, but things like screens, they're around us everywhere now, and we're very addicted to them. We use them for everything, and we sometimes need them. But it's trying to have rules around it. And I know you've done a talk about this as well. And it's not just for kids, it's for adults as well. And trying to avoid that time before going to bed with our screens. It's really, really important, and that can make a big difference on how the sleep and the quality of sleep is, isn't it?
Yeah, for sure. And I think I talk a lot about this pillar in terms of that we are all more likely to reach for any of these behaviors when we're tired. So it is one of those things that can perpetuate that feeling of fatigue, because we tend to make better, not as great decisions around what we're eating at the end of the night, or the screen time, or just staying up generally later than we want to, because we're already tired, and it just kind of keeps that
vicious circle, isn't it? Yeah.
So that, I mean, it's a whistle stop tour, and I always think when we do these things as a kind of all the pillars, it's useful to have that oversight of them all linking together, but equally each one is a sort of topic in itself, and there's probably something to pull some of these out and spend a little bit longer on them. But you know, at the end of your session, I think I heard you did something that was called stop, start, go.
Yeah,
What did you do?
So, because obviously, like you said, it can be so extensive and discussing about all of this, and we're just kind of giving all these tips and all these things you can do. And it's not about making everything perfect, as you said. It's about making things work for us, and we're all different. So it's kind of looking into how we're feeling and having heard all of this. Okay, I think in my situation I could improve this, and I think it might be doable for me to do that. So at the end of the session, we discuss about having talked about all these tips, about one thing to start doing, one thing to continue doing, so something we feel we're already doing quite well, and one thing to stop doing, because I think focusing on just something you will stop doing can be quite frustrating, isn't it? It's a lot easier to add something new rather than take something we're already used to. So if you focus on that, start one thing new, continue one thing we're doing right, and stop something we shouldn't be doing.
I like that.
It's kind of a good thing. And I did get some feedback from some patients with really lovely ideas of things they are planning to do. So that was really nice.
And I bet there was just variation in there, because again, it's very
very individual.
Works for us all.
Yeah.
Super. Well, we always try and keep these conversations short. We've run over a little bit, but that's what happens. Thank you for joining me, and
thanks for doing this.
Say at the end of the session, if anyone's got any questions, please feel free to message in, and we will try and answer them. Thanks for joining us.
Thank you.
Thank you.